fish sticks.
I don't even know if meetings happening today. Yeah. Well,
Well, still not 10 yet.
that's true.
So it's gonna be us two.
It's a little
Quiet.
quiet in here today.
Quiet. This is.
Kristen, did you get my email with the slides?
It just came in.
Computer's not connecting to Wi-Fi, so I don't know if I'll be able to share.
Okay.
I'm gonna try and restart now. There's an Ethernet cable right there. Just plug in. In theory, yes.
Or there's the blue cord.
Yeah, the Ethernet cable.
Yeah.
In theory, yeah, you can just plug in and you should be good to go. Let me try and restart. Yeah, restarting usually works for me.
I'm actually surprised that mine didn't even have no issues.
Yeah. Sometimes we get lucky. Somebody letting people in upstairs.
Yeah, Emily. I asked them. If not, then Barb would
Okay.
tell me if she.
Okay.
Or someone would.
As long as nobody's just sitting around.
Yeah.
Oh,
Henry.
the pen. I think it's pen there. Maybe it's something. Oh, good.
Emily's getting.
All right.
Must be.
Yeah.
Can everyone hear us? Yeah, okay, just.
Yep.
Okay, just checking.
Okay. Everything's 500 a night, even the Ursa. For 500 a night.
Is it just you down there?
Mr. Brett was delayed with us.
Okay.
Hi, everybody. Sorry I was a couple minutes late. Welcome to my world. Lisa Brett has a little bit of a delay. She thought she might get here on time still, but.
Yep.
Are we jumping?
Sure.
Yeah, I'm just seeing what we have for, how many do we need for quorum?
I think we can get started.
Okay, and I'll just. I'll just go ahead and.
Okay.
We can just defer the votes until.
Yeah.
I just want to bring your attention first, welcome everybody to the meeting. We rearranged this agenda just a little bit to put the consent agenda up at the top. That allows us the opportunity to approve what's on the agenda or remove for discussion. And so we have this 876 on here. Are there any discussions? So we like it. And so do we move for approval? Do I have a motion to accept and
Mike
approve?
Auerbach moved.
Second,
Mike Auerbach.
I'll second.
Carolyn Virtue, second.
thank you.
Thank you, Karen.
Take the vote.
Remember your Bonvoy password?
No, none of us know it.
I think it's the motion to
We need,
of the full vote.
All in favor?
Aye.
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 All opposed? Thank you. Remind me from this discussion, what we were sharing about the minutes here. Did we get the minutes out?
Not until Friday.
I said that Friday morning.
Thank you.
people need more time, we can.
Yeah. Is there any, we had a discussion, I just want to be fully transparent with everybody. We knew that there were delays, that we're having some challenges in the last couple of weeks getting those minutes out to you. We understand that we have the goal of getting them out to you sooner. And so just acknowledging that Lisa Britt and I were informed of what we were dealing with for a timeline here. But the minutes did go out Friday morning. Let's just address October's 1st. Is there any discussion? So with October minutes, can I have a motion to accept?
Brooke Belanger moves.
Brooke. And a
Mike Auerbach
second?
seconds.
Thank you, Mike. Any discussion? All in favor?
Aye.
Aye.
And opposed? Thank you.
I
And let's move on.
abstain. Carolyn Virtue abstains.
Thank you, Carolyn. And let's move to the November minutes. Is there any discussion? Can I have a motion to accept?
I move
Mike
to
Auerbach
accept
moved.
Joan Fitzgerald.
So we'll take Mike Auerbach to make the motion. Joan, do you want to second that?
Yes, I'll second.
All in favor?
Aye.
Aye.
And opposed? Thank you, everybody. There was a request following the meeting last month, when we used the acronym CCVHC, to have some introduction to that. As it turns out, today is the summit for the Community Behavioral Health Association, which would have really all the parties who are participating more closely in this, in the program area and in the community. And so we have put that on the agenda for a future item. And let's talk about HEE 805 subcommittee. Kara, do you want to give us an update on that?
Sure.
So the subcommittee did receive the comments and edits to the rule from Brian at the department. We've had one meeting to review those, and we got through, I'd say, probably a little over a third. We're in the process of scheduling a second meeting now. Once we get through all the comments and add our additional questions and responses, then we'll be able to give a full report to the MAC as far as what our responses are and our recommendations. Does anybody else from the committee have anything they want to add? Okay. Thank you.
Great.
Tara,
Thank you, Tara.
thank you for all of your work on this. We appreciate your efforts and that of the department.
No, thank you, everybody, for participating. I appreciate it.
Thank you, Tara. And let's move on to Rob and the LSI.
Ooh, very exciting. Rob and
Yeah.
Electronic. Should be the title of my book. So this is probably the last meeting where I'll just have nothing but titles. And then we'll actually be able to start getting into some language next month, assuming that most of this is published by the time that the next MAC meeting occurs. So for now, I've still highlighted about, I'd say, somewhere between 80 and 90 bills that might be interesting to this committee. Obviously, as we move on through the process, certain bills may fall off because they turn out not to be all that interesting to this committee, and certain bills might be added because we find out there is something to them that might be interesting to this committee. So this is just a preliminary list of ones we're looking at the moment. So I'll start off by highlighting some of the ones we've talked about in the past before moving into some, we've got quite a explosion of new ones in the last few, since last November, or since the November meeting. So we got a few more to talk about now. But starting off with relative to state participation in the Medicaid direct certification for free and reduced price school meals. This has been a bill that's been out there pretty consistently for a few years now, and something we've been supporting through, it's more of a Department of Education bill, but it's something we've been supporting through providing information and attending the hearings to answer any questions. We have relative to the use of electronic medical records. This is a bill from Representative Nagel that was introduced last year, which would prohibit requiring the use of electronic medical records, at least if it's the same bill. It's the same title, and it's by the same sponsors. I'm assuming that's what that'll be. But we'll find out when we actually have the language of it. We have directing the dissolution of the Department of Health and Human Services Office of Health Equity. Department of Environmental Services functions for civil rights and environmental justice in the Governor's Council on Diversity and Inclusion. We have establishing a commission to study the privatization of the Liquor Commission. The reason why the department would be interested in that bill is because of the way liquor affects the grid and advantage funding. So it's something we'll pay attention to. This is just a commission, so it's something that will be presumably done over the course of a period of time, but something we'll pay attention to. We have relative to the coverage of circumcision on a Medicaid state plan. We have relative to the collection of birth worksheet information. We have relative to the parental consent for student participation in the Medicaid schools program. We have repealing New Hampshire Vaccine Association. There's relative to the expectation of privacy in the collection and use of personal information. There's relative to residential care and health facility licensing. And this is where we get into some bills that are pertaining specifically to this committee. We have requiring that a public body meeting minutes include start and end times of the meeting and the printed name and signature of the recording secretary. We also have making preliminary drafts circulated to a quorum or majority of a public body available for inspection, specifying additional record provision requirements and options. And we also have one that this is a department requested bill. I don't think we can go into the language yet, but it's relative to Medicaid pharmaceutical services. We can talk about that more next week or next month, I should say. And then we have relative to work requirements under the state Medicaid program. This is one that's been recently, at least the title has been recently published. We have relative to community mental health providers. We have to enhance consent and accountability in psychotropic drug prescriptions for children under Medicaid. We have establishing a committee to study informed consent laws and medical privacy practices in New Hampshire and their impacts on patients, providers, and payors. There's relative to coverage for ear acupuncture as a substance abuse treatment under the Medicaid state plan. That was an interesting one, I thought.
Yeah.
I haven't heard of that before.
Very specific.
Yeah, I hadn't heard of that one before. And we have relative to expanding access to primary care services, increasing the number of direct healthcare providers, increasing Medicaid reimbursement rates, and making appropriation therefore. That's a Cindy Rosenwald bill. So we expect that'll be rather in-depth. So beyond that, we have HB 1 and 2, which everybody I think will be eagerly looking forward to. And that's what we got so far, at least from a highlight perspective.
Great. Any questions? Mike?
Yes, hi. There's two more bills that are sort of ancillary, but they'll definitely impact the Medicaid community. One on December 18th or 19th, GELCAR will be reviewing the new sedation rules put forward by the Board of Dental Examiners that will strengthen restrictions on oral surgeons' ability to sedate patients, as well as require an additional person in the room. That will inevitably, we believe, and we've heard from the Medicaid office on this, it will impact patients seeking emergency care that might have to go to the hospital or otherwise see a dentist who sedates. So keep that on your radar screen. The other one is Representative Schmidt has filed a bill that will prohibit the use of fluoride in community water systems. We've been fighting this one for years, but if passed, and as you all heard from the national news, there's been quite a bit of attention paid to sort of pseudo studies that would suggest a link between autism and fluoride. And although those studies have been debunked, they are making the national rounds, and this bill may have some strength to it in our legislature. If it passes, then a large portion of the Medicaid population will be significantly impacted by losing, especially kids, will be by losing a chief protector in their health.
Thank you, Mike. I'll add those to my list as well, so we can follow those throughout the process.
So did you, I thought I identified that there is a bill or an OSR on the sedation issue.
There is, yeah. Okay. Yeah, I can add that to the list. I did see it, but I think
And then I also thought I had heard that the board was considering changes to what you're describing, Michael, but maybe, I don't know if Sarah's on and has any more information she can share.
Yes, I'm on here. What I shared with you, Henry, is that at the last Board of Dental Examiners meeting, they listened to the pediatric dentists and the oral surgeons in the room regarding the extensive training that they have and the policies and guidelines that their professional associations, expect them to practice under. And the board is reconsidering or will eventually reconsider those changes. But the paperwork had already gone across to JLCAR, so now they're having to sort of pull back from that. So I think ultimately it's good that we have this legislation there, and one way or the other, some additional changes should be forthcoming with that.
We could have a period of time where what Michael described is true.
I believe that they were going to take it back up at the January meeting. Mike, was that your understanding?
That was my understanding. The way that I gleaned from the last meeting was that they were going to ask for additional review. I can't remember the exact term that the board uses, but basically asking the GELCAR to kind of back off so that they can back off and go back to the next meeting. I don't know the attitudes of the GELCAR. But generally speaking, I think if the board says they want to pull back, I would think that that would be allowed.
Yeah, they prefer not to do it twice.
Karen?
Thanks. I was just wondering if you had any more information about the parental consent with the Medicaid to schools LSR, and if it was an effort to try to restrict schools' access to those funds.
I suspect it's related to a bill that was out there last year, where it's before any services can be provided to a student, that they have to get explicit permission from the parents to do so. This led to issues where we were considering whether it was just whether the consent would apply for services over a number or course of time, or if you had to do it before every single service, every single day. I suspect it's more of that, but I haven't seen any language on it yet. So we'll.
And we don't have any insight into what prompted that bill?
There's a lot of educational bills out there for parental rights, and it seems to be an overarching theme this year. It has been for, I guess, a period of time, yeah. But there are a lot of educational bills out there this session pertaining to parental rights and what can be taught in school, what can't be taught in school, things like that. And there are a lot of competing bills as well.
And I guess I also wondered, now there's where you're in the process of changing the mechanism, as I understand it, for schools to claim the Medicaid to schools money. I didn't know if there was well, I guess you'll see whether there's anything from the federal level that would prevent them from passing this bill.
Yeah, I suspect we'll get a fiscal note worksheet request on it at some point. I have a few actually sitting in my inbox right now, but it might be one of those actually, but I haven't actually had a chance to look at anything for that. But we should know very, very, very soon what the impact is, if any.
Thank you.
I assume there will be an impact though.
Thanks.
It's on our radar.
Yeah, it's important.
Any more discussion?
I just wonder if I may chime in quickly. This has been from the New Hampshire Hospital Association. Thanks for covering those bills, and forgive me if I missed this. But we have been, we've seen one related to removing the requirements for taking all payers at licensed facilities. This is like a direct pay model legislation. It's come forward before from Representative McLean. We'll be tracking that closely. Wanted to bring it to your attention, particularly as these facilities, if passed, would not have to take Medicaid patients.
Yeah, that's been a bill that's been out there pretty consistently for at least 2 or 3 years, I'd say, or some version of it. Yeah. So I can add that to the list as well.
All right. Thank you, everyone. Thanks, Rob. And we'll move on to David for Medicaid enrollment and eligibility updates, and Lisa Britt will take over the meeting. Thank you.
Thank you, Kelly.
Great, so this is the monthly update for November. So starting with our ex parte rate, as you see for the most recent month with ex parte, which is January 2025, it was 85%. So it remains, high, just as high as it's ever been. It's been over 80% now since September. We do expect some changes to the ex parte rate over the next 6 to 7 months, as the flexibilities we've been relying on as part of the public health emergency and the unwinding are expiring at the end of June. And CMS has allowed states the option to continue some of those flexibilities, but there are some additional obligations and conditions states need to meet to continue using them. And this is just our general trend in Medicaid enrollment and eligibility group going back from essentially the start of the pandemic up to December 2nd, 2024. So total enrollment was just over 182,000. And this is looking back over the past year. As of the first of the month, what was the enrollment eligibility for different categories from low-income children, children with disabilities, foster care, adult expansion, so granted advantage, and just tracking that over time. So you can see as we've discussed before, the growth in the children's population. There's been, and you can see also the growth in granted advantage here too, as well. It sort of tapered off though. And then the grand total from this time last year, we had just over 178,000, and now we're up to 182, so growth of 4,000. And this is the summary of redeterminations that occurred for November, and this is for the adult population. So there are just over 8,700 redeterminations. 7,546 completed the redetermination, 862 closed. With the majority of the completed redeterminations were done passively, so that reflects the high ex parte rate. And then there was a failed to ready of 552, with income being the second highest reason for closure.
What's that number, David?
552. Let me see if I can do that.
That's okay. No. Thank you.
And for the children's population, there were 4,605 redeterminations for the month of November. 380 closed, just over 4,000 completed redeterminations. A large portion of those were passive, and then 307 of the closures were for failed to ready. And this is the summary report for November for the waiver population. So there were 1,162 redeterminations, 1,024 completed. There were 6 closures. The majority of the reopenings were done passively, just over 1,000, 1,001. There are pending, 132 pending, but that is because we still have the flexibilities that allow for an additional 60 days for individuals that are in the waiver population. So if they do not complete the redetermination for November, they have December and January to complete it. And this is just a drill down look from that waiver population into the CFI population. So there were 347 redeterminations for November, 3 closures, 324 completed the redetermination. And there are 20 pending for the same reason there. But the majority of the CFI population redetermined through the ex parte and passively. And this is a drill down to the nursing facility coverage. So there are 277 redeterminations for November, 186 completed the redetermination. There were 2 closures. The majority of the reopenings were passive, with 176 that passively renewed. And there are 89 pending for the same reason, the additional 60 days. And this is the CMS reporting and closure reason. So this is what we report to CMS. You can see there was a 90.3% retained Medicaid. So they had a successful renewal. We've seen a high number above 88%, mostly in the 90s, I think since September of 23 last year. And then, Bert, if you don't mind giving an update on the call campaigns that the MCOs have been working on, and then your departments or your unit's been working on.
Sure. So just taking a look at the MCO call campaign, These were calls that were made in November for the month of October. Closures were based on failure to do their redetermination or failure to submit required verifications. Total number of calls for this was actually 721 individuals. That was up from 566 in the month of September. We did notice a few things in this previous month. Percentage of messages left actually decreased from 55 to 44%, which shows we were reaching more individuals. Incorrect contact information went from 12% to 10%, and full voicemails or just unable to leave a message went from 14 to 10%. So looking at these numbers, what we're seeing is that 30% of the individuals that that the MCOs were able to reach had actually already were working on their redetermination. 28% had completed them and were reopened. We were looking at 18% that had new insurance. This would be either private or through an employer. 3% have moved out of state, and let's see. And of the individuals that the MCOs reached, none of them were unaware of the children having different income levels, which is good. So next, we're looking at the Medicaid unit. Now, these are calls that were made for the messages that had been left by the MCO the previous month.
Can I ask a question before we do that? Do you reach out to the auth rep too? Is that who you're calling?
If the auth rep is the individual that we have, yes.
Okay.
So it'll, for example, for the children, of course, we're reaching out to the parents or the guardians.
Yes, yeah.
If the auth rep is the individual that's indicated with phone number, then that's who we reach out to.
Okay.
So looking at the Medicaid units calls out, 110 attempts, 37 were actually, we were able to reach. Now, these were ones that had been attempted in the previous month, so we were calling ones who already had a message left, at least one message. Of the ones that were reached, we had 41% of those, or 15, had already done their redeterminations and had opened. 13 were aware that their redetermination was needed, and they were actively working on it. We had 2 that had done their redetermination and had been found to be ineligible. And we actually did find 3 that were unaware that children had a different income requirement. 2 had new insurance, and 1 had actually moved out of New Hampshire.
Great. Thanks.
Thank you very much. Thank you, David.
Shall we move on?
Yeah.
Okay. Do we have a Jordan?
Oh, wait, Kim has a hand up.
Perhaps I missed it. Is the medical closures for the waivers included anywhere?
There were some issues with the data in that report this month that the team's looking into. It reported just aggregate numbers to me, but I don't have the breakdown for whether or not they met level of care, or if they did not meet level, was it for failure to provide or for the medical determination. But once the team has had a chance to pull out the information, we can update the slide deck and send it to the group.
It is the critical issue for a number of patients who need care that they are not receiving in the community. So it's important data to share.
Yep.
Thank you.
No problem.
Joan?
Yes, good morning. Perhaps this is showing my lack of knowledge, but on a redetermination, is that an annual base? Is that on an annual basis or a monthly basis?
Annual.
Annual. Okay, thank you very much.
No. Unless they have a spend down.
Change in
Change, yeah,
Or
change.
Yeah.
Okay. Okay,
And
thank
then
you.
it's, in some cases, if a person is also on, or a household is on SNAP as well, and SNAP is every 6 months. And so if their SNAP eligibility renews and there's enough information to complete the Medicaid redetermination at that time, where they would continue to remain open, we'll push the Medicaid redetermination out for another year from the SNAP determination.
If you have SNAP eligibility, it can mean that you get extended more than once in a year.
Yep. Yeah.
Thank you.
Other questions? Okay, hearing none. Do we have Jordan? Jordan, if you're talking, we can't hear you.
Not
She was on.
seeing her on, but this is just an update on the Medicaid to Schools RFP. And we're just working through the final process with contracts and expect to get it posted in the next week or so.
Okay.
But once it's posted, we can share the link to the RFP posting group.
Okay, very good. Judith, your cat made an appearance. All right, well, then let's move on to the department updates. We can go to Dr. Finney with dental.
Good morning. So I'd like to start out by saying that last Friday, the New Hampshire Oral Health Coalition hosted a day-long meeting where all of us oral health stakeholders were hanging out. We spent the day talking about everything related to dentistry from birth to elderly years, because oral health really spans the entire lifespan. It was an awesome meeting. A lot of good conversations happened. We got to talk, we had a panel discussion about the adult dental benefit, which was very well received. So it was a good day. We're really trying to promote the importance of oral health. And so that was a great way to do that. Now towards, I have an awesome provider enrollment update. We suddenly surged to 188 providers at 132 locations. That's an increase of 14 providers since my last report to you. And I just want to give a shout out to Jen Dean from DentaQuest, who basically lives her life on the road, going from practice to practice, meeting with providers that are enrolled to see how they're doing, as well as those who still haven't enrolled, to try to encourage them. So I think that you see the fruits of her efforts. She's awesome. And I think that, you know, slowly but surely, we're getting where we need to be. And I'm just happy that we continue to see growth in the network. We also continue to see growth in the number of unique members served. We are 50 individuals shy of 18,000 members being served to date since the implementation, and we've had close to 57,000 claims over that time, which is really good. The last couple of months, we've been over 3,000 claims, which is sort of our new high level. So I'm happy to see that we're staying there. That wasn't a fluke. We have a mobile schedule that goes up until December 22nd. I believe that Solvere felt like they needed to pause between the Christmas and New Year's holiday, but they'll be right back at it in January. They're seeing very good results, having added additional dental hygiene appointments to each mobile event. So we're seeing larger numbers of folks being served at each of those events, as well as they are using wait lists at every single location. So if someone cancels last minute or doesn't show up, they have individuals that they can start calling. And that has significantly reduced the number of, open slots that go unused, because we really want to make sure that those events are maximized.
That's a tough task too.
It is, and I have to say, DentaQuest is doing a great job. There's one dedicated phone number to call if you're trying to schedule an appointment for those events. And at the same time, if someone isn't able to book a definite appointment, they immediately go onto the wait list for that location. And, they get it, that, they need to have somebody in that chair at all times. And so I have to give them credit. They're doing an awesome
Nice
job of making sure that we're efficient.
Sarah, the mobile van includes weekend hours for people.
Right, and that's another key thing. Right now, the vast majority on Saturday and Sunday, but there are some Fridays and Mondays. And then there are some very specific locations, like Hope on Haven Hill, which is sort of, that can be during the week. But if there are openings, we're also trying to book in individuals from the community, the surrounding community, again, to make efficient use of the truck being there.
Can I just piggyback on that? Just say broadly, like for everybody to hear this, but it's not a dental issue. We at Center for Life Management are doing Saturday clinics as well. And for intakes, for anything that, and it really is improving access to services.
So as of December 3rd, we had 126 events with 1,247 members treated. So that's a significant number of individuals who have been able to use the benefit. The last thing that I want to mention is that there is a New Hampshire Smiles Member Advisory Board meeting on Thursday, January 23rd. It is a virtual event. And I provided Kristen with a copy of the flyer for this. We're really reaching out to all of you here to share this widely. We want to encourage our members to participate in this meeting. This is an opportunity to talk to individuals from DentaQuest, to really discuss, what your needs are, what is the program doing, where could we be better. It is critically important that we get input from our members to know where it is that we need to improve things, where there may be gaps that we're not even aware of. So please don't ask, just share and share widely. Like I said, it is a virtual event and we're hoping to get some good participation from our members. And these are quarterly meetings, so I will keep you posted as those become scheduled. And I think that's it for me. If there are any questions, I'm happy to answer.
I have a question. If CLM were able to host a space for people to come in and attend that, let's just say in our training room, and is having a group setting conducive to your virtual?
That's a good question. I'm going to take that back to my friends at Northeast Delta and DentaQuest, and we'll chat about that, and I will let you know. I hadn't even thought of something like that, but that might be.
Let me know. I mean,
Yeah.
we might be able to support people accessing and participating.
Okay, thank you.
Any questions for Dr. Fitty?
Thank you.
All right, let's go to Scott with the DDU update.
I checked and he wasn't on, but I reached out to him. He hasn't seen my message.
Okay.
I did let him know that we're in the department updates.
Okay, all right.
So he might comment, depending on.
Yep. We can go out of order, that's fine. Do we have anybody to talk about the adult and youth reentry?
We do. I can talk about, so we've still planning to implement the adult and youth reentry at the Department of Corrections. All their sites in the state, which there are 4 or 5, I think 4. And then also at Sununu Youth Center, we've met with, I think, 7 of the 10 counties to sort of get a feel for where they're at so we can develop an implementation plan. We're working with them. So we're going to be starting on January 1st. There has to be a little bit of a lead into identifying people to put them into sort of the program. Like we're going to look back 90 days or 60 days from January 1st, right?
Yeah, into the future. So we're gonna on January 1st, DOC will look to see who is eligible for release date 90 days from January.
And then we'll start working with them on eligibility and getting them into the 45-day program or the 30-day program or both programs if they're eligible for both. So there's a lot of work to get this all lined up, but I think we'll be among the earliest states to do so, at least to have a instance of it stood up.
Great.
And we'll be doing, I think after implementation, we have under the waiver a 6-month. So we'll be back to the committee here to, what do we call that? Under the waiver, we have to have a implementation review with the committee. So that'll be coming up.
Great. Are there questions for Henry about the community reentry? Okay, seeing none. Henry, you want to talk to us about amendment number 2 on the NCO contract?
Sure, we're working towards getting amendment number 2 on through governor and council. The governor determines when it will be on, but we're hoping to be on soon. And when it's public, I probably at the next meeting, hopefully, can give a more detailed briefing on it.
Okay, great.
And the ARPA spending plan on November 29th, we received approval of our second quarter being of the federal fiscal year. We may seek an extension to be able to use all the funds, but don't have anything more specific on that right now. And under waivers, David and I were at the National Medicaid Director Fall meeting. We talked with CMS officials about the presumptive eligibility component. With the change in administrations, they're trying to address needs in all states. We had originally expected that it would be sometime in 25 that would probably come about, and still think it will come about sometime in 25. But there's a lot of work to be done before administrative changes. But we're in the queue, if you will.
What was the sort of mood? Well, I guess I don't know how the meeting lined up with the announced proposed head of CMS, but maybe the listserv has been chattering.
Yeah, that was the announcement on appointments came after. I mean, when we were there were fewer than 70 days left in the term of the appointed people, and they were aware of that and were doing the best they could to address states' needs that were urgent that might get delayed in the transition. Mm-hmm. We think things will slow down for a period of time. That's fairly common, but as we get into it, we'll share more.
Okay. Thank you.
Did you try calling him on it?
Yeah, I can try calling Scott.
Yeah, we'll try to call Scott.
Yeah, I messaged him again.
Well, we're waiting to see if Scott increases on this page 2 of the agenda. there's the status on some rules. There's a link to the roadmap. There's the link to the agency budget. As people know, the governor-elect has a chance to adjust what happens there for her budget, which she has like less than a month to make adjustments to. And then in the parking lot, we have the MAC and BAC changes that are the regulatory changes federally. If we want to talk any more about that at the moment, but I know there were a few handouts that were included
With the agenda.
that in terms of recruitment, I think one of the biggest things is to get the beneficiary perspective. I think ultimately we're supposed to have a beneficiary advisory committee that has 75% membership of either people who are beneficiaries or people who represent beneficiaries like family members and such. And it's 6 months away from next month, and so it's just out there to remind us we have a bit of work to do as a group.
I think I recall when we had our prep meeting that we maybe wanted to solicit volunteers for a subcommittee that could really start leaning in over the next several months on, how to recruit folks for the Beneficiary Advisory Council, how to make sure that the content is meaningful and they keep coming back and that sort of thing.
Yes.
Um,
We do want to. I was going to leave that to you.
Okay.
To maybe speak to.
So, for those of you does it have to be just MAC members on the subcommittee?
No, I mean, if I think that, I think that's up to you, but I think, trying to fill out those positions, 25% can be people who are on MAC, as well. And just to remind folks that the way the regulation works is that the BAC has to meet before the MAC meets, so that there are issues teed up that we may need to consider. So starting in July will be the first BAC meeting. Then our next, after June, our next meeting of MAC will be in August, so we'll alternate every other month.
So I'd like to ask current MAC members who are interested in working on a subcommittee with folks from the department about, getting the BAC up and ready for July 1st. I think it will be several months worth of work, and there will be work to do between meetings. So maybe what we can say is, for anybody who is interested, if you could email Kristen, and maybe copy Henry and myself, if you are interested in working on that subcommittee to launch the BAC, that would be great. And maybe do that by Thursday. Does that give folks enough time to assess their availability?
That'd be great.
Yeah, okay. So if you want to do it, let Kristen, Henry, and myself know by Thursday, and we'll start getting some planning around that.
Looks like Doris lost. Yes, happy to help.
Excellent. We have our first volunteer. Thank you, Dr. Lodge. Okay.
Scott joined.
Oh, good. Okay. Scott, thank you for joining us. We were moving through the agenda at lightning speed today.
Yeah, you guys are moving today. Wow. way ahead of schedule. Awesome. Okay. So Kristen, I don't know if you want to pull up the.
Yeah. Having trouble for some reason. I have it, it's just Sharon.
Yeah.
Oh, wait a minute. There you go.
So as you see, we're making progress. There's a total of 31. This is as of the end of November. Total of 31 HCCSD cases for the children. Only one of those over 90 days, which was due to providers not responding timely. So we had to send more than one request, which tied us up. And you'll see from last month with the adult cases, we had 36. With the adult cases, there's a total of 576 pending, compared to last month where there was a total of 725 pending. 288 of those are over 90 days compared to 405 of those being over 90 days last month. So the contractor's really coming in fast. Out of that 288 cases, 247 of those are in the final stages. They're ready for, they're currently actively being worked on by the medical review team. So making great progress there. I did keep in, so out of the 576 cases, 173 of those individuals are receiving SSI or SSDI. That number may be a little high due to, we found, again, it hasn't been corrected, but that even individuals that were pending were being counted in there. So that number is likely a little bit lower than that. Other than that, there's not much else really to report. You know, making progress and moving forward. So I'm feeling really good about the direction we're going and hoping that you know, next month we'll see even better.
Yeah, that's really nice progress, Scott. I'm happy to see that. Thank you for sharing.
Thank you. Any
Thanks,
questions?
Is that something in the chat?
There's a comment.
Okay.
Yeah, Karen Rosenberg just said, nice to see the progress.
Excellent. Thank you.
Thanks, Scott. Keep up the good work.
Thanks.
All right. Have we done the entire agenda in an hour?
15 minutes.
Yeah.
Yeah, right.
Yeah, we were. Yeah.
Wow, that is a record. All right, who wants an hour back? Entertain a motion to adjourn.
So moved.
Looks like Brooke is seconding that motion. All, or nobody wants to discuss that. All in favor?
Joan.
Aye.
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 Merry
Oh,
Christmas,
no,
everybody.
I was just putting my thumbs up.
Oh, okay. All right, everybody. Well, as this is our December meeting and we probably won't talk again, I hope everybody has a wonderful holiday season. Do what makes you happy.
Thank you.
Same here.
Happy holidays, everyone.
You're here.
Yeah.
Thanks. Bye.
That's the way you do it.